I have a liver ultrasound and then a hematology visit. Yay! Turns out I took my Zofran a little bit too late, if you know what that means. But I think I didn't throw up any medications that were vital to my health, so that's good. I don't know what I threw up, maybe like calcium or something. But all is well. Some days I do fine without Zofran. I thought today I would be fine, but I was not. And it hit like so fast, but it's fine. We're good. Hey bud, I heard you playing the tambourine. Nice job. Nice job. I love to hear your music when you play your music. Okay, this morning we're getting ready to leave. I have a liver ultrasound this morning and then a hematology visit. First time meeting this hematology team. And the reason I'm seeing hematology, I will say I'm a little worried I'm gonna get there and they're gonna be like, we can't do anything for you. Or why are you here, or something like that. My blood counts have been weird since I was in college. At least that's the first time I remember hearing my doctors or nurses talk about my blood counts. And at that point, I think it was my white cell count was low, because I remember leaving the hospital. I was back in Maryland on a college break. And, or wait, is that right? Yeah, I think that's right. And I remember leaving the hospital on IV antibiotics, and they said, your white cell count is low. Be careful. Oh, ow! Buddy. This is going well. Be careful. I forget certain things like flossing my teeth or something like that. They gave me a list of things to be careful about. Since then, my whites have remained low and my platelets are always low, even to the point of like I've had platelet transfusions when I have sinus surgeries, that sort of thing. So yeah, and certain antibiotics can make my platelets go way low, and also my whites. So then you guys have probably heard me talk about Neupogen, which is an injection that tells your bone marrow to make more white blood cells, and I've had to take Neupogen when I'm on IVs. So I'm painting the picture for you. My blood is weird, and historically we've talked about, are my platelets low because I'm not producing enough, or is it just because my spleen is like sucking them up? Because we know sequestering is a thing, especially with my brand of liver disease, like portal hypertension, I guess. Is that what causes the sequestering? I don't know. But anyway, my spleen is huge and they think that that's part of it. But then there's always this question, is it a production problem? Maybe it's not just my spleen. So all of that to say, I have seen hematologists in the past. They typically don't, yeah, there's really no answers per se. But my team, my CF team here has questions, you know, and especially for the future, like if I have to go on certain medications, we need to know how to deal with my blood counts. I've had to come off of medications before because my blood counts get too low. Now, since discovering Neupogen, that has happened a lot less. Like I can do Neupogen and then stay on whatever the antibiotic or whatever it is that's causing my blood counts to go low. So I'm going to the hematologist today. It's an appointment that I've waited over a year for, and that's sort of, you know, the name of the game. It's not a rush, but ultimately my team does have questions about my blood or about my numbers and why it is such and kind of how to move forward. They've mentioned if I would potentially need a bone marrow biopsy. So these are the sorts of things that we will ask today and try to find out. But the first thing is liver ultrasound with Doppler, which is, I think, checking the blood flow to and from my liver, maybe. So we're gonna get ready and head out. Good morning, by the way. Waiting and napping. Waiting and napping. Okay, all done. It's a longer one when they do the Doppler. But actually that was not as long as sometimes. Sometimes it takes like over an hour. That was like only 40 minutes or 30 minutes. She just went out. She has to ask the radiologist to take a look. Oftentimes they do have to come back in and take more pictures because the radiologist might have this shadow. It's like a fatty pad or something. It's some sort of thing on my liver. So sometimes they see that and they need to take a closer look. There's also spots on my spleen from when I had infarctions, so I never know if they're gonna take more. But it wasn't a problem, surprisingly, that I had the gauze there for my feeding tube, which exploded on the way over here. I brought 2 extra gauze and extra tape, and I thought, like, I'm on top of it. Well, I had to use 1 on the way here, and then we'll see. I might need to ask the nurse for more gauze later, but yeah, so we're just waiting to get the all good to go, and then yeah. But here's the cheerleader section. That one's asleep, and that one wants to be asleep. I was gonna make a clip, but there's a lot of people. Yeah, wow. This is awkward. Awkward. Okay, they did not need to take any more ultrasound pictures, so yay. We are heading over to my hematology, even though my appointment's not for 2 more hours, but we figure it's worth going and asking if they could happen to see me now, because we have open swim in, well, about at the time of my appointment. Open swim starts at 12:45. So I would really love to go, but we'll see if they can get me in or not. If they can't, I think Elijah and Peter will just leave and go swim, and I'll stay here and do my appointment. Okay, baby's getting a really good nap today, so that's awesome.
And that could be cut off.
Guess what? The doctor didn't have any other patients to see, and they said they can see me now. Yay! I get to go swimming later. Peter just said.
I was like, I hope they don't say, so why are you here?
Because this is like, it's rare for, I guess,
Yeah,
it's not normal for
kind of
CF
like
people.
A unique situation.
But when he said, what if they say, why are you here? I was like, I literally just vlogged and said, what if they say, why are you here? Every day's a celebration over here. Yay! Yay!
Can you clap, clap, clap?
Okay, we just parked. We're gonna grab some lunch before going to swim because we get to go to swim class. Well, open swim. The visit with the hematologist was really good. She was really great, and I learned that the liver produces a
Something.
something an element that tells your bone marrow to produce platelets. So I suppose we're presuming that my liver potentially isn't doing that job effectively, since my platelets are chronically low. But she talked about doing a bone marrow biopsy. She's basically going to talk with my CF people and my liver people and talk with my doctors and decide together if a bone marrow biopsy makes sense to do it right now or in the future, if and when transplant time comes, or if and when my neutrophils are really low, that sort of thing. So it was a good visit. I'm really thankful they were able to see me early. We got out of the hospital pretty quickly, which is really nice. And done for another, I don't even know. I don't know when my next appointment is. Let me look, because I think it's next week. Wait. Oh, well, Monday I have pre-op for my feeding tube. And I'll be doing some blood work for like my CF team or my liver team. So anyway, thanks for joining us today. Kind of a whirlwind, but good. We got the appointments done, and as always, we'll see you soon, guys. Thanks.